Hello everyone, my name is Leslie Barajas and I will be doing a presentation on Alprazolam. Now you're probably wondering, what is Alprazolam? Alprazolam is a specific type of benzodiazepine central nervous system, or CNS, depressant. It provides treatment for anxiety disorder, panic disorder, and depression. It was popularized in the late 1970s and early 1980s after benzodiazepines, Xanax, and Libermium began to replace Valium, a top-selling prescription drug during 1972 through 1978. Examples for prescription names for Alprazolam are Xanax, Xanax XR, and Nervim. Form and method of use. The main form of using Alprazolam is through monotherapy. Monotherapy refers to the use of a single drug to treat a disease or condition. Alprazolam comes in different forms of medicine. It comes through regular tablets, extended release tablets, orally disintegrating tablets, which only dissolve in your mouth and don't require chewing, and concentrated solutions or liquid, which come in droplets. Doctors will start off on small doses and will gradually increase the doses no more than once every 3 or 4 days, depending on how necessary they are needed. Effects when taking Alprazolam. There are numerous short-term effects when taking Alprazolam. Such effects are drowsiness, lightheadedness, headache, tiredness, dizziness, dried mouth, joint pain, difficulty concentrating, increased salivation, nausea, change in appetite, weight changes, and difficulty urinating. Some long-term effects when using Alprazolam are shortness of breath, severe skin rash, seizures, yellowing of the skin or eyes, confusion, problem with speech, problem with coordination or balance, and turbulent mood swings. It is key to communicate these issues with your doctor if you develop or undergo any of these side effects when taking Alprazolam, and describe the severity of each effect. Risk and consequences. Developing an addiction to Alprazolam is one of the most common occurrences to happen. Abusive and usage of the drug. When abusers use Alprazolam for non-medical reasons and taking the medication more times than prescribed or recommended, there's often cases of overdosing on Alprazolam and possibility of death due to severe addiction and abuse of said drug. Withdrawal process from Alprazolam. Alprazolam, also known as Xanax, withdrawal symptoms tend to be very cruel and brutal, especially after many months or even years of abusing the substance. At times, it causes many individuals to relapse from the intense psychiatric symptoms and drug cravings. The withdrawal process can typically last up to multiple weeks, months, or even years. Individuals should seek out treatment and regular therapy when undergoing the withdrawal period. Xanax use in college students. According to a research article by the Drug and Alcohol Dependence, they stated about 36.8% of undergrads reported lifetime use of prescription drugs for non-medical purposes, and that usage peaked during their junior year of college. Other reasons for students to use Xanax or Alprazolam is to help relieve any stress or anxiety from exams, minimize the stress of being away from home, alleviate uneasiness from being in an unfamiliar environment, or many others tend to use Xanax to due to their psychological trauma or for their mental illness disorders. And these are the references I use for my entire presentation. Thank you so much for watching, and I hope you guys have a wonderful day.